Have you ever heard the saying that the eyes are the window to the soul? Hi, I'm Dr. Raghu Athre. I'm a double board certified facial plastic surgeon based in Houston, Texas. So when you're watching this video, when we're talking to other people, when we're having conversations with other people, normally the way that our brain works is that we end up focusing on their eyes and their mouth. This is very common. So it makes logical sense that periorbital or around the eye rejuvenation is one of the most common chief complaints that I get in the office. So just as we look at other people's eyes, we also look at ourselves in the mirror, and this is one of the first areas that we notice aging, this little box right here. So in other videos, I've discussed upper eyelid and brow lift and things like that. But one area that we seldom really discuss is this lower eyelid complex, how to rejuvenate it. So first of all, I think we should start with the anatomy of the lower eyelid complex. The lower eyelid complex is actually a very complicated area. It's one of the toughest areas to rejuvenate because there's a lot of little things going on here. So first you have the true eyelid. Okay, this is actually the skin and the actual eyelid portion of it. Then you have the orbital rim, which is the bone that surrounds the eye, and then you have the cheek complex. So all of this kind of, there's a zone in there where it all blends together, and we kind of look at this in one unit. I look at it as the lower eyelid complex, and what I really mean by the lower eyelid complex is the actual lower eyelid, the orbital rim, as well as a little portion of the top portion of the cheek slash midface. And it kind of looks like a teardrop. So it starts here and kind of tapers out into the cheek region right there. So this complex, to hit the grand slam home run in this area, is actually really hard. Okay, so now since we've kind of defined our parameter, like we're looking at the map view, now let's take a look at more detailed anatomy of this area. So when we look at the eyelid itself, we've got skin, okay? That's the outermost layer, okay? Underneath the skin, there's something called the orbital septum, okay? Which is a thin band of tissue. And then underneath that, you have fat, okay? So if we look at it from superficial to deep, we have skin, orbital septum, fat, okay? So that's one. Then we've got the bony orbital rim, which is kind of a is an anatomic kind of boundary line of what I call eyelid and cheek. And then underneath it, we have the cheek. Okay, so when we look at somebody and we say, hey, listen, I'm looking old, I'm looking tired, and my lower eyelid is really not helping the process, how do I look at this process? So what I do when I examine somebody is, first of all, I look at something called the snap test. How tight is the eyelid? Okay, is their eyelid rebound very quickly, or does that skin just stretch and kind of hang out here before it ends up coming back towards the eyeball? What is the position of the eyelid? The healthy lower eyelid should cover about 1 millimeter of that colored portion. You shouldn't see any white between the colored portion and where the eyelid margin is. Okay, so these are some very structural things that I look at. The next thing I look at is the quality of the skin in this area. Okay, is it thin? Is it crepey? Has it lost collagen? Is there a lot of skin? Is there not enough skin? Okay, so these are the next set of questions I look at. Fast forward. Then I look at the fat of the lower eyelid. Okay, so how much fat is there? One of the most common things that I get consultations for is I have lower eyelid bags. And when I look at these people, I go, do you have significant fat pooching out? And most of these people don't. So it's very important to really assess this area and take a look and see how much fat is there, okay? I, in my head, make an imaginary line from that orbital rim. So if the face is set perfectly straight, I draw a vertical line from that orbital rim and then go how much fat sits proud to that vertical line. Okay, The next major thing that I look at is this midface right here. This midface is very important in that lower eyelid region. Why? So what happens is when we're young, okay, this fat pad lives way the hell up here, okay? It's nice and tight to that bone and it lives very high on that bone. As we age, this fat pad and the structure, the midface, starts to descend. As it descends, it creates this groove right here. That's called a tear trough. So when you get that tear trough, what it can do is make the eyelid look like there's an eyelid bag, but actually it isn't an eyelid bag, and it's just this midface fat pad that has fallen down. So now we understand this whole box of all the little things that can be going on in that lower eyelid region. So the lower eyelid region is not something where I go, hey, a patient comes in, has fat bags or lower eyelid bags, let's just go do a blepharoplasty. Doesn't work that way. It really does require a little bit more careful analysis to figure out what types of procedures does this patient really need. Okay, so now we kind of gone over a little bit of the anatomy, a little bit of what can go on. Now let's take a look at the aging process. Stage 1 of aging, okay, and there's no age limit or boundaries. This is just what happens, okay? This midface fat pad, we tend to lose a little volume in there and it tends to fall. Now in that level of aging, what we can actually do is fill in that void right there, okay? You've got a couple of options. One, you can go with a hyaluronic acid filler, or what I prefer is using your own fat. Now, for the purposes of this talk here, going into a long discussion about why I prefer fat is beyond the scope of this talk, but it has benefits in that it lasts longer and it enhances the recovery process, the natural regenerative process, so that you can rebuild some of the volume in that area. That's my overall gestalt of why I prefer fat. So stage 1, midface comes down, you see skeletonization of this area, you add fat. Okay, stage 2, midface fat pad comes down, so you've got skeletonization, okay? But you've got a little bit of this fat behind that orbital septum starting to pooch out, okay? Now, in those cases, what I like to do is graft fat in this region and do a transconjunctival blepharoplasty, meaning I'm going to go in from behind the eyelid to remove some of that fat. Okay, so the fat that's pooched out, we're going to remove that, giving you a nice smooth contour between lower lid and cheek. Stage 3 of aging, okay? Midface fat pad comes down. More fat pooches out, and you have a mild amount of skin excess. The skin can be thin, but there's a little bit of skin excess. In these cases, I like to move the needle a little bit further, and what I like to do is transconjunctival blepharoplasty, meaning from behind the eyelid, either a chemical peel or laser in this area with some fat grafting, okay? Now, why did I choose the laser or chemical peel? The reason for this is there's not enough skin for us to go in there and take the skin out. We want to really just thicken that skin a little bit, grow some collagen so that it's not as crepey, not as thin, and tighten that little skin envelope a little bit. The final stage of aging is not only does the midface fat pad come down, you've got a lot of fat excess, a lot of skin excess. In these type of patients, I will frequently make a subciliary blepharoplasty where I go right underneath the lash line and remove a little bit of skin, remove the fat, put the skin back down, might do a chemical peel if that's in the game plan, and may do some fat grafting. So you can see it's kind of a very stepwise approach to how we address this. Why am I so particular about how I address this lower eyelid complex? So I think this is a good point to transition into the complications of this area. So the most dreaded complication in this area is something called ectropion. What is ectropion? Ectropion means scar tissue that does this, or pulls the eyelid down. The primary cause of ectropion is over-resection of the skin. So remember, gravity's pulling down on you. So if you take too much skin, you're basically tethering everything down, and that's going to create that scar tissue that pulls your eyelid down. In order to minimize this, prevent this, we need to be super cautious about how much skin we excise. This is the reason why you saw in the earlier stages of aging, I like to do a transconjunctival blepharoplasty so that there is no skin excision, okay? I do not want to take the chance of ectropion if there shouldn't be one, okay? It's not until I have a lot of excess skin that I go in there and do an incision from the outside where I actually remove a little bit of skin, okay? And in those cases, it's because there's so much excess skin that it does need to be removed. It's beyond the capacity of what a laser or a chemical peel can do. Okay, that's the reason for this logical stepwise approach to the lower eyelid. So when you come in and you send me a consultation saying I have aging lower eyelids, you can expect me to kind of go through this process and figure out where your aging process has benchmarked you, which stage you are. So therefore I can go, what procedure or combination of procedures is really going to attack that area and give you the best result and minimize the chance of complications. So I am sure that somebody is going to put in the comment section here, so what is the chance of ectropion? Well, this really depends on surgeon to surgeon, okay? An experienced surgeon who's done a lot of these, like myself, I've had no cases of permanent ectropion, okay? And that's because I'm super crazy meticulous about this area, okay? Now, do you sometimes get temporary ectropion because of scarring? Sorry, not because of scarring, but because of bruising and swelling? Absolutely. That can happen. However, the goal is to have that, to know the difference between where you're going to get permanent ectropion and what is temporary. Okay, so the long and the short of this talk is as follows. Number one, there is no one-stop shop fix the lower eyelid. The lower eyelid is a very complicated structure, okay? It involves parts of the lower eyelid as well as part of the cheek structures. Two, in order to see what procedures are in your best interest, it really requires very careful analysis by someone who's experienced in doing procedures in this area. Three, rejuvenation in this area may not be a singular procedure. It really might include a combination of one or two procedures in order to give the best result. A common thread that you saw in a lot of my stages of aging is fat grafting. I really think that fat grafting is a key in rejuvenation of this area. It adds some necessary volume, it creates regeneration of these tissues, and really helps soften this area and give you a more natural look. I really hope this video has helped you in case you're considering a lower eyelid procedure or any other type of facial rejuvenation procedure. As you know, I love to teach, I love to share some ideas, and I love to hear your comments. So if you've got a comment, send me a message down in the comment section and I'll try to get to it. If you like this video, please, please, please hit the subscribe button. It'll keep you up to date on what's going on our channel, and you'll get further notifications down the road as we release new videos. If you have questions, you know how to get a hold of us. We always love to hear from you. Thanks again.